CPPS evaluation time. So you come in and I do a very extensive eval. The reason why I do extensive eval for CPPS is because it's been there. It's part of your nervous system. It's part of your immune system. The brain is cycling, chewing through it 24/7 when you're awake and especially when you're asleep. Pain is also accompanied by limbic system. Your amygdala is processing pain every day and assigning an emotional component to it. Once you have something that has an emotion to it, you will remember it for the rest of your life. This is why we remember painful episodes. We remember when pain started. So when I do an eval and I collect your information, I'm also fully aware that I cannot treat you like an orthopedic patient. You are a neurological patient. So I have to go in and speak to your brain and your nervous system nice and polite with very, very soft hands. The treatment is nice because I turn the lights down. I actually stop speaking because I am trying to listen to your nervous system. I would like to speak to your vagus nerve. So if I'm treating you and I am, let's say, working on your abdomen, like just doing my fascial release to see how your body will interpret my touch. And if a patient breaks out in cold sweat, I know I'm talking to the nervous system at this point. If a patient says, oh, I have ringing in my ear all of a sudden, the brain is listening to us. And we're not discussing the weather or the politics at this point, right? I am telling you what to do, how to breathe, what to do with your legs. I'm telling you to stiffen up at some moments, but also release at some moments. Because your brain has to be comfortable as I'm treating you. It has to flow with me like ocean waves. If I make your brain uncomfortable and I reintroduce the pain or aggravate the pain or just cause more pain, your brain will protect you further. So I just did a big disservice to you. So I have to be very mindful and very educated when I touch you in certain ways that I am not upregulating your nervous system and I'm not telling your brain to protect more. My goal with CPPS patients is to calm the nervous system down and show the brain the war is over. All of the enemy has retreated. Now let's clean up the field and plant some flowers, and now it's just quiet time. So the brain has to be convinced it does not have to protect you any longer. It is a hard job because brain already is on the journey, running a marathon of protecting you, and now I have to say, stop. Back up. Tell me where you got scared. What caused this pain? Where's the dysfunction? And I have to reroute your brain to do something else. So for example, if somebody comes to me and they say, I have horrible vaginal pain, 24/7, I cannot sit, I cannot stand, I cannot pee, every time I poo, I'm on fire. And then this person falls and injures their rotator cuff, right? So now they're going to have rotator cuff repair, they're going through that surgery, that recovery, and I usually ask the patient, how's your pelvic floor? And they go, oh, I forgot. It's because the brain went somewhere else to protect you. So that tells you if we reroute the brain to go somewhere else and do something else and keep the brain busy somewhere else where you're super healthy and functional, it's going to let go of the pain slowly. But also keep in mind, when you're starting to make a little progress, and the progress is little, you're going to do 3 steps forward, 2 steps back. 5 steps forward, 3 steps back. We're going to do that dance just like the ocean waves, like I said, right? Because we're not orthopedic. You're not coming in and popping your pelvis in and your hips in. That's orthopedic. You could get up and you'll feel great and you'll go. My job is to talk to your nervous system. And the minute I address your nervous system, we call it neogenesis. The nervous system starts to grow new little nerves, right? and change the pattern of the frequency, change the pattern of the idea of protection. So, is it complicated? Indeed. The complicated part is to find where the body's protecting you. But once we find it, we could reroute it. I have to find that dysfunction, put a detour around it. So while we're healing your dysfunction, your brain is running a detour around it and not paying attention and developing new and healthy pathways. But believe me, we always find it, and we give you hope, and you become in control of your own nervous system.